Here's a shift worth noting. Better healthcare is care that meets patients where they are. United Health Group is bringing it directly to living rooms. This is a win for patients managing chronic conditions. And here's the interesting thing. By closing those care gaps, administering in-home exams, and identifying risks earlier, more diseases can be prevented and patient outcomes can improve. In 2025 alone, United Health Group patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
For adults with Crohn's disease or ulcerative colitis symptoms, every choice matters. Tremfya offers self-injection or intravenous infusion from the start. Tremfya is administered as injections under the skin or infusions through a vein every 4 weeks, followed by injections under the skin every 4 or 8 weeks. If your doctor decides that you can self-inject Tremfya, proper training is required. Tremfya is a prescription medicine used to treat adults with moderately to severely active Crohn's disease and adults with moderately to severely active ulcerative colitis. Serious allergic reactions and increased risk of infections and liver problems may occur. Before treatment, your doctor should check you for infections and tuberculosis. Tell your doctor if you have an infection, flu-like symptoms, or if you need a vaccine. Explore what's possible. Ask your doctor about Tremfya today. Call 1-800-526-7736 to learn more or visit tremfyaradio.com.
You're listening to In Good Health, the trusted news source for medicine, science, and technology. I'm Elizabeth Westfield.
I'm Mayan Vasta Betancourt.
And I'm Greg Johnson. This week, how a doctor turned her cancer diagnosis into advocacy.
I don't know whether I'm going to live or die from this. I don't know whether it's going to be stage 4 or just 2B, but I've got to do something with this diagnosis outside of fighting for my life.
But first, a guide to living with ADHD that prioritizes compassion and education.
ADHD has a 100% failure rate. No matter how hard you try, no matter what you do, there is going to be a day where you forget about the meeting or you lose your keys because our systems will fail.
All that and more this week on In Good Health.
Here's a shift worth noting. Better healthcare is care that meets patients where they are. United Health Group is bringing it directly to living rooms. This is a win for patients managing chronic conditions. And here's the interesting thing. By closing those care gaps, administering in-home exams, and identifying risks earlier, more diseases can be prevented and patient outcomes can improve. In 2025 alone, United Health Group patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
Eating healthy doesn't mean you have to eat out at a pricey restaurant. Healthy Choice Simply Steamer's grilled chicken and broccoli Alfredo is an easy, high-protein meal with nothing artificial. The steam tray keeps the sauce separate, so you get crisp broccoli, creamy Alfredo sauce, and tender grilled chicken that's delicious every time. And it's a satisfying meal with 28 grams of protein. You can find it in the frozen aisle. Healthy Choice. What having it all tastes like.
Cate Osborn had excelled through high school, thrived in undergrad, and earned 2 master's degrees before her brain began to short-circuit. Weeks before she was expected to perform in 2 plays, Osborn found herself in an unthinkable situation. At best, Shakespeare's words slipped out of her head no matter what strategy she tried. At worst, she couldn't even bring herself to sit down and focus. The skills Osborn had relied on her entire life had disappeared, and she was left sobbing on her couch, frustrated and confused. But where Osborn was convinced she was going crazy, a friend suggested a much more common cause to blame: ADHD. Attention Deficit Hyperactivity Disorder affects more than 15 million adults in America. But Osborn had always been told smart girls like her couldn't possibly have it. But as she'd find out, that constant dismissal was based on nothing more than common misconceptions.
My story is really common for women with ADHD, and it is that I am a high-achieving person. I loved school. I was great at school, but I was always struggling somewhere else. And so whenever I would seek help and say, like, I'm really struggling, I really feel like I'm drowning, I really feel like I don't relate to my peers, and I'm struggling in all of these ways, they would always look at my grades and they would just say, oh my gosh, well, you're so smart. You do so good in school. How could you possibly have ADHD?
Several months after that initial breakdown, Osborn was diagnosed with ADHD and finally began to understand herself for the first time at age 30. And as she began to dig into how it affects her life, Osborn started creating online content to share her findings. She connected with fellow online advocate Eric Good, and together they've written the ADHD Field Guide for Adults. It's a science-backed book that explains how ADHD affects all aspects of life, offers various coping strategies, and affirms the human behind the diagnosis. It touches on the fact that women go undiagnosed much more often than men, particularly because their symptoms are often internalized. But it's not just women who are chronically overlooked. Societal and cultural expectations can have a big impact on how ADHD symptoms manifest. And since the stereotypical signs are based on white boys, people of color are much less likely to receive a diagnosis, simply because their symptoms aren't being recognized.
And when you combine that with cultural racism and white supremacy and that kind of stuff, you wind up with BIPOC students not getting diagnosed with ADHD, but they're diagnosed with like behavioral disorders, or they're just bad kids, or they're troublemakers, that kind of thing. We also see less diagnosis among BIPOC students and less access to treatment and that kind of thing. And so the shoebox is stacked, right? Like if you are a woman, that is one thing. If you are a Black woman, that is another thing. And it becomes this stack upon stack of conversations around access and stigmatization and cultural understandings.
So it can be really hard to get a diagnosis if you don't fit into the original cookie-cutter idea of what ADHD looks like. Doctors may also miss the symptoms because another condition is also present, like depression, anxiety, or autism. Since it's estimated that up to 80% of adults with ADHD have at least one other co-occurring condition, Osborn believes that one of the most damaging things when talking about ADHD is only talking about ADHD.
We talk about the only thing that you are experiencing that is frustrating is ADHD. But statistically, if you look at populations with ADHD, people with ADHD are far more likely to also be struggling with depression, anxiety, sleep disorders, sexual dysfunctions, issues around food, addictions, gambling issues, substance use disorders, all of these different things.
Issues that only get worse when ignored and left untreated. On top of that, most people with ADHD also have trouble sleeping, which can make all of these conditions even harder to cope with.
Sleep issues make depression worse. They make anxiety worse. They make relationships harder. They can impact your libido, all of these things. So it's never just one thing. To me, it would be fascinating to find the person to whom it is just ADHD, just a little bit of ADHD and nothing else, because that I think is much harder to find than the average person with ADHD who is with at least 2 or 3 comorbidities.
Many of these conditions also have an impact on our executive functioning, which is already impaired in people with ADHD. These mental processes are in charge of tasks like planning, focus, and impulse control, which is why people with ADHD may have a harder time with time management, emotional regulation, and working memory.
But the interesting thing about people with ADHD is that it is a spectrum, right? So some people are really good at the emotional regulation part, but they're terrible at the time management part. Some people are awful at the time management part, but they're really good at the task organization part. So there's no one specific way of having ADHD.
Which Osborn says makes it challenging to talk about how executive functioning is impaired, because it's different for each person. Another obstacle is that these deficits can evolve over time. Since both our brain and environment changes as we age, the symptoms of ADHD do too.
And there are a lot of moments in our lives across sort of like the ADHD population that we see things changing. And a lot of times it's when you're going off to college for the first time and all of a sudden you have to like be responsible for your own schedule. A lot of times it's when you move in with a partner for the first time and you're sharing a home and you're like navigating, chores and that kind of thing. Pregnancy is another big place where ADHD behaviors tend to change. Menopause is another big one where a lot of women find ADHD getting much, much worse during that period of their lives.
Osborn herself experienced this major hormonal shift after she had had one of her ovaries removed. These noticeable changes helped her finally get an ADHD diagnosis.
I went from being someone who was like generally kind of keeping it together. I was always a little bit behind. My house was always a little bit messy. My dishes were never exactly all the way done, but I was managing. I was coping. And then when I lost my ovary and I had this massive hormonal shift, I went from that kind of messy chaos, maybe running a little bit late, but I do a good job of making up for it, to genuinely feeling like I had early onset dementia. I could not remember things. I could not sit down. I could not focus. And I was terrified. I had never experienced those symptoms with that amount of severity. And it was so scary because I took pride in being a person who, could like be in fancy Shakespeare plays and do that kind of stuff. And then all of a sudden it was just gone.
These dramatic changes may also be what's causing the rise in older adults receiving an ADHD diagnosis. What used to be a rarity has become one of the fastest growing populations in the community. A 2024 study reports that the largest increase in first-time diagnoses between 2021 and 2024 was seen in people ages 30 to 64. Osborn says many of these people had created coping skills and systems to mask their cognitive deficits without even knowing it. But as she's experienced after her surgery, it can be a major challenge to figure out new strategies when the condition evolves, and you have to build them from scratch. Osborn's book breaks down what these systems can look like, how to create an effective structure, and what to do when they fail, because they will fail.
Let's say you forget where you put your keys. And so you're like, I'm going to put them in this key bowl every day. And then that's where I put my keys. The nature of ADHD, the way that ADHD manifests in our brains is that there is going to be a day where for some reason, something, that key bowl is no longer going to be the thing that works. Your brain will start to tune it out, or you will forget that it exists because it's been sitting in the same place. And so there will need to be a moment where you change that system. And that is one of the most frustrating things about ADHD. ADHD has a 100% failure rate. No matter how hard you try, no matter what you do, there is going to be a day where you forget about the meeting, or you lose your keys, or you forget about the doctor's appointment, or whatever it may be, because our systems will fail.
It even happens to the best, most thought-out systems. It could work for years, and then one day, for no apparent reason, it's no longer a strategy you can rely on. You lose your keys, you miss a meeting, you forget about a date, a normal thing that could happen to anyone. It's these moments that Osborn hopes to intercept with her book, teaching the readers that while the systems will fail, you are not a failure.
That was the part that nobody ever taught me. Nobody ever taught me that there's a difference between your systems failing and you being a failure. And often, especially when we start talking about neurodivergence, those two things are so conflated. They're so tragically intertwined. It's, well, why don't you just get a planner? Why don't you just do this, that, or the other thing? And the answer is because we can't. Because we can't, or we tried it. We tried it 100 times, or we tried it for 3 years and it was great. And then one day it stopped working. And that is the part that can be so difficult to explain and so difficult to name if you are not a person living with ADHD.
This need for structure is where support and education becomes essential. It may play a part in why so many older adults are seeking out a diagnosis. Having a label doesn't change anything that's happened in your life, but it can change how you view it. And it opens the door to support that you never had access to before.
So getting a diagnosis is a deeply personal decision, honestly. For some people, they might actually need it. They might actually need the paperwork or the piece of paper that says, I have ADHD and therefore I need accommodations, or I need assistance, or I need medication, right? For some people, it is more of an identity thing. It is more of a moment in their life where they get to step back and they get to say, it wasn't just me. I wasn't just this like fundamentally broken person. It has been ADHD all along. And that moment for a lot of people can be deeply meaningful. It can be deeply symbolic. It can also be a period of grief and mourning for, why didn't anybody notice? How did they miss the, field of red flags that I left behind me?
Osborn's book, The ADHD Field Guide for Adults, is available now wherever books are sold. You can find more information about Cate Osborn and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.
Coming up, do doctors make the best patients? When Radio Health Journal returns.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Dear McDonald's, your breakfast menu? Fire. 10s across the board. I could be happy with anything, even though I order the same thing every time. Thanks for not judging me. I'll try something new next time. Maybe.
Score a 2 for $5 deal on a sausage McMuffin with egg and more. Limited time only. Price and participation may vary. Cannot be combined with any other offer. Single item at regular price.
Ba-da-ba-ba-ba.
Dr. Sylvia Owusu-Ansah was on the ride of her life in 2025. The pediatric emergency physician received an honorary Emmy Award for her work on the hit medical show The Pit, and her own film was selected as a finalist for the HBO Short Film Showcase. She was celebrating with a friend at the American Black Film Festival when they heard a mutual acquaintance had passed away from colon cancer at age 45.
And my friend looked sternly at me and she said, when you go home, you better not mess around and you better get all your screenings done. And I hate to admit, I hadn't had a mammogram in 4 years. I was overdue for my colonoscopy by 2 years. And at the time, I was having left upper quadrant pain as well for 6 months that I didn't know what was going on. And so was simultaneously scheduling for workup with that.
Staying true to her word, Owusu-Ansah flew back home to Pittsburgh and began checking appointments off her to-do list. The endoscopy for her GI tract came back clear, and a colonoscopy showed there wasn't even a polyp to worry about. The mammogram was her last obligation. She noticed some abnormalities during the scan, but wasn't too worried.
Like most women, I was considered to have small, dense breasts, which usually you spot like a lot of benign tumors. I had a biopsy done over a decade ago. And so I had many mammograms where I flagged for these benign tumors and, would get the mammogram and then I'd have to wait to talk to the radiologist. It was like the same old, right? It was never just a mammogram and go.
But this time, the test showed some additional irregularities in her lymph nodes. Still not thinking it's a big deal, Owusu-Ansah scheduled a repeat test. A month later, she sat for the same scan, but noticed the physicians were more active than usual.
I was getting a mammogram and they were doing, again, I'm a physician, doing way more shots than they usually do. I usually don't get an ultrasound with my mammogram. So they suggested I get an ultrasound. And then again, I'm a physician. There was a circle in my breast and the ultrasonographer is measuring that circle. And so then I knew something was wrong. The ultrasound tech can't say anything and she's got the measuring calipers up, she's measuring the tumor, so to speak. And I'm like, well, it could just be a big benign tumor. But so I laid there quietly and I was kind of in shock, because I knew what I knew, but I tried to unknow what I knew.
It would take another month and a biopsy to confirm one of Owusu-Ansah's greatest fears had come to life.
I get the call, the call that you see on these Hollywood movies of like, is this Sylvia Owusu-Ansah? I said, yes, it's Sylvia Owusu-Ansah. This is Nurse X from Y clinic calling about your biopsy results. And I could tell from the tone that it's cancer. It wasn't good. And so she said, yes, very monotone, very robotic. Yeah. So your, biopsy results came back and you have invasive ductal carcinoma, which is a type of breast cancer. And I'm a doctor, so I understood that much. And then the rest was almost like Charlie Brown's mom talking. Wah, 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 wah.
Invasive ductal carcinoma is the most common form of breast cancer. It starts in the milk ducts, then spreads to surrounding tissue. Owusu-Ansah knew this much, but that's as far as her expertise could take her.
Now with cancer, they do all kinds of markers. They look at all kinds of proteins, basically, that help to delineate what type of cancer you have, how fast it proliferates, how aggressive a tumor is, whether there's a risk of recurrence. I didn't know any of this. I had not looked at breast cancer since medical school. So that was over 20 years ago on slides. And obviously things have changed since then. So this was complete Greek to me. And I think that's when I really was like, I got to advocate for everybody else in this boat, because I'm like, if I'm a physician and what you're telling me is Greek, I can't imagine the woman or even the rarer man off the street who has breast cancer and comes in and you're telling them all these things.
Owusu-Ansah says the decision to publicly share her journey on social media was a no-brainer. With so many unknowns in her future, she jumped at the chance to have any sort of good come out of this diagnosis.
I don't know whether I'm going to live or die from this. I don't know whether it's going to be stage 4 or just 2B, but I've got to do something with this diagnosis outside of fighting for my life. So I decided right then and there that no. With this experience that I'm having right now, my initial mammogram in July, having to wait another 30 days to get some kind of confirmation, and then another 2 weeks to get a biopsy. And I'm a physician in the system. We got to do something different.
Owusu-Ansah announced her diagnosis to the world on October 1st, 2025, and has continued to keep her followers updated on her journey, never shying away from the hard parts. She's been able to show how a doctor advocates for care as a patient, especially realizing that many people often feel powerless in these settings.
They don't feel that they have that autonomy or flexibility in any kind of way. I do have some of that. The best example I gave was I was starting to have, so my first chemo, I didn't have my port inserted yet in order to easily get blood work done and for the chemo to infuse without them having to poke me several times. And so one of the nurses, the only vein she could find was in my right hand. And so the first chemo was infused in my right hand. And I tried to explain to her, this is probably not a good idea.
Despite Owusu-Ansah voicing her concerns, the nurse moved ahead with using her right hand as the entry point. It would be another month before she'd get her port put in, and Owusu-Ansah wasn't willing to delay her chemo any longer.
So she fused it in my hand. It's interesting. She's the same nurse that followed up 2 days to see how I was doing and was like, I didn't realize you were a doctor. I'm so sorry. And in my head, I said, it doesn't matter. It doesn't matter that I'm a doctor. I'm a patient, should advocate. So anyway, soon after that, I started having numbness and tingling in my right hand, predominantly in my DIP joints, at the tip of my fingers, predominantly my middle finger. And then the next chemo cycle came and there was more neuropathy in my right hand.
Her care team didn't think it was related to the chemo, but as the symptoms worsened, Owusu-Ansah wasn't willing to accept that answer.
And so I believe by cycle 3, really was very vocal. I was vocal through all of the chemotherapy cycles, but I was really vocal after cycle 3 that, hey, I can't even wipe myself, excuse the detail, but and this is my right hand and I'm an ER doc and I'm getting concerned and, I don't want it to be an irreversible process, at the end of the day. Right. And my nurse did say, advocate for yourself early. If you let us know about these things later on, then these things can be irreversible. So long story short, my medical team for my 4th cycle of chemo reduced the amount of chemotherapy. And guess what? After that chemotherapy, my hand was as good as new.
Still, Owusu-Ansah says her team wasn't dismissive of her, and they were looking into other possible causes, but changing her entry point did bring back function in that right hand. It's that open communication that Owusu-Ansah says is so important to have between patients and their care team. Asking questions is one of the best things a patient can do.
Ask all the questions. Ask about the chemo. Why this type of chemo, not another type of chemo? Why are we doing chemo first and not surgery first? What is the purpose of radiation? What are the additional side? What should I be expecting over the next 6 to 8 weeks, right? Knowledge is truly power. Even if you think it's the dumbest question in the world, ask it of your medical team. And if they can't answer, push them to find somebody to get the answer for you or circle back with the answer.
And since these situations can be overwhelming and intimidating, she says that it's always a good idea to bring a loved one along who can help advocate.
It's not easy for everybody to advocate for themselves. And I recognize that. It's not easy for everybody to speak up. And it can be very intimidating, especially if you go by yourself. So I always advocate, bring a partner with you if you can, especially for those who don't like to talk or not very verbose or very quiet, to have somebody speak up on your behalf, whether it be your spouse, your partner. If it's your parent, you go in for your parent, your parent bring their child in. If it's an older parent, bring your adult child in, vice versa.
In addition to speaking up in appointments, being the best self-advocate also means being knowledgeable about what you're up against. Owusu-Ansah advises reading up on your disease and the range of treatment options available. You can find more information about Dr. Sylvia Owusu-Ansah and her social media journey on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
In Good Health returns in just a moment.
Here's a shift worth noting. Better healthcare is care that meets patients where they are. United Health Group is bringing it directly to living rooms. This is a win for patients managing chronic conditions. And here's the interesting thing. By closing those care gaps, administering in-home exams, and identifying risks earlier, more diseases can be prevented and patient outcomes can improve. In 2025 alone, United Health Group patients received over 19 million home visits. Learn more at unitedhealthgroup.com/commitment.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Eating healthy doesn't mean you have to eat out at a pricey restaurant. Healthy Choice Simply Steamer's grilled chicken and broccoli Alfredo is an easy, high-protein meal with nothing artificial. The steam tray keeps the sauce separate, so you get crisp broccoli, creamy Alfredo sauce, and tender grilled chicken that's delicious every time. And it's a satisfying meal with 28 grams of protein. You can find it in the frozen aisle. Healthy Choice. What having it all tastes like.
Dear McDonald's, your breakfast menu? Fire. 10s across the board. I could be happy with anything, even though I ordered the same thing every time. Thanks for not judging me. I'll try something new next time. Maybe.
Score a 2 for $5 deal on a sausage McMuffin with egg and more. Limited time only. Price and participation may vary. Cannot be combined with any other offer. Single item at regular price.
Ba-da-ba-ba-ba.
Medical notes this week. Are autistic brains structurally different? A new study in the American Journal of Psychiatry reveals that the brains of autistic individuals have fewer receptors for the most common neurotransmitter in the brain. Researchers think this reduction is associated with the various characteristics linked to autism. While many neurodivergent people do not require treatment, this breakthrough could lead to more precise diagnostic tools and support for those whose quality of life is impacted by the condition. Is keto the key to a more resilient brain? Research in the Journal of Neurochemistry shows that a high-fat, low-carb diet may preserve cognitive health. It provides an alternative energy source for brains that struggle to process glucose. Scientists also found that mice with the strongest genetic risk factor for Alzheimer's had healthier gut bacteria and more brain energy. These findings suggest that tailoring a person's diet to their specific DNA could be a powerful tool in slowing or stopping the signs of decline. A test that can speed up decision-making in cancer treatment. A study in Nature Communications reveals that a new blood test can determine if a brain cancer treatment is working after just a single dose. Physicians can now quickly pivot to more effective therapies, sparing patients from the grueling side effects of treatments that aren't working. And finally, good news for sugar addicts. Scientists have created a healthier sweetener using tagatose. It's a rare type of sugar found in some fruit and dairy products that researchers have been able to biosynthetically produce. It's nearly just as sweet as table sugar, but has 60% fewer calories. Research also suggests it reduces the growth of some cavity-causing bacteria and has probiotic effects for the gut. And that's Medical Notes this week. I'm Mayan Vasta Betancourt.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Thank you for joining us this week and every week as we break down the science stories you need to know. You can find all of our past segments and guests on our website at ingoodhealthpodcast.org or wherever you listen to your podcasts. Follow us on Instagram, Facebook, and X for more behind-the-scenes content. Tune in next week for another edition of In Good Health.
Life's busy. Don't let banking slow you down. Whether you're paying bills, setting savings goals, or just splitting the check, Atlantic Union Bank makes managing your money easier. With helpful people and user-friendly tools, we make sure banking with us fits you. Call, visit us online, or drop into an Atlantic Union Bank branch today. Atlantic Union Bank. Any way you bank.
Few things are as uplifting as the greatest moments in sports. And nothing brings us together quite like Team USA at the Olympic Winter Games. From NBC Universal's iconic storytelling to the innovative technology across Xfinity and Peacock, Comcast brings the Olympic Games home to America, sharing every moment with millions. When Team USA steps onto the world stage, we're not just watching, we're cheering together. This winter, we're all on the same team. Comcast, proud partner of Team USA.
Eating healthy doesn't mean you have to eat out at a pricey restaurant. Healthy Choice Simply Steamer's grilled chicken and broccoli Alfredo is an easy, high-protein meal with nothing artificial. The steam tray keeps the sauce separate, so you get crisp broccoli, creamy Alfredo sauce, and tender grilled chicken that's delicious every time. And it's a satisfying meal with 28 grams of protein. You can find it in the frozen aisle. Healthy Choice. What having it all tastes like.
Dear McDonald's, your breakfast menu? Fire. 10s across the board. I could be happy with anything, even though I ordered the same thing every time. Thanks for not judging me. I'll try something new next time. Maybe.
Score a 2 for $5 deal on a sausage McMuffin with egg and more. Limited time only. Price and participation may vary. Cannot be combined with any other offer. Single item at regular price.
Ba-da-ba-ba-ba.